physician associate is a new healthcare professional who's trained specifically to work in medicine to deliver medical care to patients, and that means working in conjunction with the doctors to do that. So we have PAs who are working in paediatrics, we've got PAs working in general medicine, in surgical specialties, so across the full range.
I became a physician associate because I was really looking for a challenge in my career. I couldn't see doing the administrative roles that I had been doing for another 30 to 40 years until the retirement age. And so I looked around and I had become interested in medicine and taking care of patients. And so I thought, many years of becoming a doctor, or actually a fairly short course, very, very intensive, to become a physician associate, and my decision was made, and it's the best decision I ever made.
I became a physician associate because my previous job working in a lab was quite insular. I wanted to have a much more patient-facing role, and I heard about physician associate studies and I decided that was what I wanted to do. I think certainly within a hospital a physician associate adds a huge amount to a medical team because rather than say an SHO or registrar who rotates on their placements, a physician associate will stay on the same ward within the same team for potentially their entire career, but certainly longer than 6 months or 9 months. So it gives that level of continuity.
So my current role is as the course director for Physician Associate Studies at St. George's University of London. So our program is in its 9th year. We started with very small numbers, but now we have a fairly large group of students in our first year, 68, and we are contributing every day to the medical workforce. Our second year students in particular actually provide a service. So yes, they are students, but they are seeing patients and delivering part of the service even as students.
We're all postgraduates. We've all done biomedicine or nursing, or in my case genetics. We have a good fundamental understanding of how the human body works before we even start training. And then it's a 2-year incredibly intensive, incredibly rigorous training program that we go through.
I believe that physician associates really add benefit to the medical teams. They are a consistent member of the team. They increase access to healthcare for patients. They increase training opportunities for the junior doctors. We know there is a huge crisis and pressure in the health service right now in terms of the workforce, and we know that actually having a physician associate will actually help distribute the workload and therefore improve hopefully the work-life balance and the quality for all of the multidisciplinary team, including the doctors, because they can share that workload.
So the role of the physician associate in the NHS is actually unlimited, in my opinion. So we can expand into any areas. There are already physician associates working in research, we work in education, we are involved as experienced physician associates in the education of medical students and junior doctors. Obviously a newly qualified physician associate isn't teaching a foundation year 1 doctor, but it is, as we expand our role, we can make that contribution as well, freeing up the consultant's time or the registrar's time as well to do the things they need to do.
We are at the point where our numbers are rapidly increasing and people are coming into the workplace, and obviously the workforce crisis and that's ensuing at the moment within medicine. PAs are there to help ease that workload and ease that pressure.